we get these questions. Actually, it's two questions. What do consumers care about most? What do consumers care about least?
Actually, the question that they usually ask us is, what should I promote? First
Well,
or second?
Right.
Yeah, but
right.
it's the same question.
It's the same question.
Same question.
So basically, and you have to do this in current times. 2001, 2006, you could get away with incorporating much more electives into your promotion than you can now. Now, it's all about staples, family dentistry, conveniences, technologies, public relations assets. Can I trust this dentist? You have to arrange your public relations assets in such a way that it invokes an elevated feeling of trust and respect. The basics, the base of the dental consumer's wants, that's what they are right now. Moving forward, well, okay, what do consumers want least?
Well,
they don't want to get referred out
right.
all over the planet.
Right.
Okay, they definitely don't want a restricted scheduling opportunities.
Right.
All right.
They would be happy not to wait 3 weeks for a crown or a restoration.
Yeah, that's technology.
That's
right?
technology.
I mean, you can come in for one visit and from prep to seat in an hour and a half or 2 hours.
Right.
That's huge. They don't know they can do that. How many people on our research had no clue that existed? It was way over 80%.
Yeah.
And how many of them said that they would change dentists because of it? That was the
killer thing right there.
That was the killer.
If there was a technology out there that existed, we didn't even use any brand names because they wouldn't recognize them anyway. Right. That you could go in and get whatever work done you needed in a single visit crown, for example. Would that be of interest to you? Well, yeah, of course. Would you even change dentists or drive a little farther to another dentist to get that technology? Yeah.
Yeah.
And then their next question was, that doesn't exist, does it? Really?
Yeah.
They had no clue.
Right.
And that was true for things like Invisalign, short-term ortho,
yep.
Other short-term ortho products. So the consumers really, they value something that makes their life easier.
Absolutely.
Okay? If their husband didn't snore, their life would be so much easier.
Right.
Right? So it's these kind of things that you focus on and promote in addition to a limited number of elective type services, because they'll get to those later.
Right. You get them in your office now. Take good care of them. Ask them the age-old question: what do you like and what do you dislike about your smile?
Yeah. Would you like whiter teeth?
Would you like whiter teeth? Just the easy questions to ask them. And if their answer is, no, I'm fine, you know what, 6 months, 9 months, a year from now, 18 months from now, they're going to be a big case.
Yeah.
And I ask dentists this all the time. I said, would you turn away a big case 18 months from now? And the answer is always no. For 25 years, the answer's been no.
Or even 3 years from now.
Or even 3 years from now. You don't care, okay? Really, in the grand scheme of things, you don't care when Mrs. Jones says, let's talk about my smile makeover now.
Yeah.
Right? I mean, you're just elated because I hear stories all the time.
But they're not going to say that on the first visit, usually.
Yeah, usually they won't. Usually it's going to take 6, 12 months now.
Yeah.
A little bit of faith, a little bit of trust building, relationship building, and again, as soon as the credit comes back into the marketplace and she can pay all that off with home equity, they're going to get their case done.
Yeah.
Right. So one of the things that matters least now would be oversaturating your advertising with electives.
Right.
Okay. You don't, and certainly don't go out there and only focus on one elective.
Right.
Okay, you can. We're never the ones who say you can't do it.
Right.
Okay, the purpose of these FAQ videos is to help guide you.
Right.
If you came to us as a client and said, "Hey, Mark, I want to put 60% of my annual marketing budget into promoting only implants," which is a pretty common question that we get.
Yeah.
I would not say no. But you're going to really need to understand the realities of the expectations
in the marketplace.
Trying to take 60% of your marketing budget and promoting only one piece of dentistry.
Right. We have a good friend of ours actually seems to be the exception to that rule. He's focusing totally on implants, and he has a periodontist come in, and they work together, and that's almost all they do. We have another client who almost all he does is sleep apnea and short-term ortho. But both of those practices have been promoting heavily into their communities for years.
Family dentistry.
And doing family dentistry.
Family dentistry. We didn't go out and ask the consumer to respond to what the dentist wanted.
No.
We asked the consumer to respond to what they wanted, came in, saw the dentist. The dentist said, these are possibilities. We can help you with your husband snoring. We can help you with that missing tooth. We can help you anchor your dentures so that they don't slip anymore. Right? But we didn't go out and ask for those people. We went out and asked the consumer based on what the consumer wants, and then the dentist took it from that first exam forward, and they do boatloads of cases.
Yeah, and then the need and want in the consumer will develop over time.
Right.
But it's not something that they're going to knock on your door and say, I'm ready for my full mouth rehab.
No.